Fiona. Great to see you all. Sorry I'm late. Just to start, I'd like to extend my thoughts and the thoughts of the people of Western Australia to the people of Ukraine at this very difficult time, and express our solidarity with all West Australians of Ukrainian heritage and those with connections and relatives in the Ukraine. My government stands with the Commonwealth Government in condemning the unprovoked and brutal aggression by the government of Russia towards the people and the country of Ukraine. As you know, to 8 p.m. last night, WA recorded 1,043 new cases. Of these, there were 1,039 local cases. 4 are travel-related cases. This is off the back of 12,040 PCR tests, not including all the rapid antigen tests being conducted. Today's cases do include 113 self-reported positive RAT tests. WA now has 3,038 total active cases. 12 people are in hospital, no people are in ICU. Our best wishes are with the people in hospital. Even though these types of case numbers are what we were expecting, I understand it may come as a shock to some West Australians. Many may know someone who has caught the virus. Many more know someone who is isolating. But once again, I want to stress, this is not a cause for panic, but it is a reminder to take the virus seriously as we manage it in the community. Make sure you and your family are prepared and have a plan if you or someone in your home has to isolate. If you live alone, make sure you have someone who you can contact to help with food deliveries if required, as well as check up on you over the phone. Make sure you have what you need to hand at home: food, water, paracetamol and a thermometer. But only what you need, don't go overboard. Just be prepared. And if you haven't already, make sure you get your third dose if eligible. Our third dose rate is now at 61%. It puts us in the strongest position to be able to handle this Omicron wave. But the higher we get it, the better for the whole community. On Monday, Level 1 public health measures were rolled out across Perth, Peel and the Southwest, Great Southern, Wheatbelt and Pilbara. This meant the return of the 2 square metre rule and capacity limits across a range of venues, limits on gatherings at homes and limits on visitation to aged care and hospitals. At the same time, baseline measures were extended to the rest of the state, the Gascoyne, Kimberley, Midwest and Goldfields Esperance. They were mask wearing and proof of vaccination requirements. I'd just like to say thank you to every Western Australian for following these new measures and doing the right thing. Now, as I said last Friday, Omicron is fast moving. It's the fastest moving variant we have seen in the pandemic. As a result, we have now seen Omicron spread to every region around the state, not to mention remote communities, especially in the Kimberley, which is a significant development. As such, in accordance with the latest health advice, from 6 a.m. tomorrow, that is 6 a.m. Saturday the 26th of February, Level 1 public health social measures will be rolled out to the Kimberley as a priority. And from 6 a.m. Monday the 28th of February, the remaining regions currently only on baseline measures will follow, with Level 1 public health social measures being implemented. From Monday, the entire state will have the following rules in place. The 2 square metre rule will be in place for all hospitality and entertainment venues, bars, restaurants, cafes and the like, cultural venues, fitness venues, hairdressers, beauty services and places of worship. The 2 square metre rule is the main principle with specific settings for the following venues. Seated entertainment venues like theatres and cinemas can have 75 up to 75% capacity. Nightclubs will have the 2 square metre rule, but crowds are capped at 500 patrons, and in addition, indoor home gatherings will be limited to 30 people. Outdoor home gatherings will be subject to the 2 square metre rule, capped at 200 people outside. Private outdoor events not at the home will be capped at 200 people. These rules bring the rest of the state into line with Perth, Peel, as well as some of the more southerly regions. Some parts of WA have never had these kind of rules in place. Many parts of WA have avoided lockdowns and these kind of restrictions for the past 2 years. It will take some adjustment, but I'm sure regional Western Australians will rise to the occasion. While I'm sure this is less than ideal for many regional businesses, it will mean that businesses in the Gascoyne, Kimberley, Midwest and Goldfields Esperance regions will be eligible for the same support as other businesses from the state government, financial support that is. That being rent relief, licence fee relief, safe operation support and other financial support for specific businesses and venues. It won't cover everything, but it will provide some much needed relief and support through some bumpy times ahead. Rising case numbers across the state means rising numbers of people in isolation, even though that period of isolation in practice is only for a handful of days. It still causes disruption to workforces. We've seen what happens over east when the incredibly fast spreading Omicron speeds up and sends more and more people into isolation. As you may be aware, the state has critical worker rules for when the state reaches a very high caseload environment, which means in certain industries and occupations. If a worker has been designated as critical by their employer, in the event they are a close contact but asymptomatic, they can keep working under strict conditions, including daily testing. While we are not yet needing to trigger the very high caseload settings, we are getting close. In the meantime, to ensure our most essential workers in a pandemic are prepared for what is to come, we will bring in those settings for our police force as well as for our health workforce, doctors, nurses, GPs, pharmacies and the like. In the event our police or health workers are designated a close contact but do not have symptoms, they can keep working with the following requirements. Return a negative RAT test daily. Wear a surgical mask when outside the home. Travel alone if possible, and isolate when not at work. In the event symptoms develop, they must stop working and follow the normal symptomatic close contact rules. In the event they return a positive RAT test, they are then a positive case and must follow the positive case rules. Even with precautionary measures, having asymptomatic close contacts in the workplace is a higher risk. But we have to balance that against the cost of having higher and higher numbers of health staff and police isolating at home. It is not a problem today, but we need to move these settings now to ensure that it does not become one. This is just for police and health workers at this stage. However, employers in other industries need to be prepared if they need it. Eligible employers need to register their critical workers on the online critical worker furloughing registration system now to ensure they are ready for a very high caseload environment. There are strict rules about what kinds of roles are critical, and they are all on the website for employers. This should only be used as a last resort for a temporary period given the risks. It is telling how quickly Omicron has spread across the state, and while it might seem like overkill to some, ultimately we know that reasonable restrictions today can help avoid tougher ones tomorrow. While rising case numbers are not something we are used to, they're a reminder to take the virus seriously, but not panic. It's so important to ensure. If you're unwell, stay home and get tested. If you haven't already, get your booster. As of yesterday, WA had the highest third dose rate of all the states, which is a stunning achievement, given we have the second lowest rate of people eligible for boosters. But even though we are performing so well, we can get more people triple dosed. We know that it can make all the difference. Omicron is here. If there's something you need to do to protect yourself and your loved ones, do it now. From Monday, the whole of the state, from Kununurra to Esperance, will have the same set of rules, designed to slow the spread of Omicron, minimise disruption, save lives. So now more than ever, right across WA, we are all in this together. Just before I take questions, just another matter, there's a potential tropical cyclone brewing off the Kimberley coast, which may bring dangerous weather over the weekend and into next week. The Department of Fire and Emergency Services have issued a cyclone blue alert for people near Columbaroo and Wyndham, but not including Kununurra in the Kimberley region. This means there is no immediate danger, but people need to prepare now by tying down loose objects, getting an emergency kit ready, and checking in with friends and neighbours. Heavy rainfall may also impact roads. For anyone planning to travel through the Kimberley, consider delaying your movements until the system has passed. The alerts will continue to be updated today and over the weekend in line with weather forecasts. Continue to monitor the Emergency WA website, call 13DFES or follow DFES social media, the Main Roads travel map and local radio broadcasts. Thank you. Are there any questions?
Just with the police considered close contacts, how will they go travelling alone if they need to partner up with someone?
I'm sure the Police Commissioner will manage that. So what it's allowing for is if police are close contacts and asymptomatic, and the health workforce as well, if they have daily negative RAT tests and a range of other things they put in place, as I outlined earlier, they can continue to go to work.
But does that not pose a safety issue with them needing to partner up?
I'm sure the Police Commissioner will manage those sorts of matters, but this is required, as we outlined some time ago. This is one of the things that will be required as we get to higher case numbers in WA.
Level 2 measures, are you starting to think that they won't be able to be avoided?
Well, that's a discussion we're now having. Obviously, I'm not so keen on the what's called the 4 square metre rule, which is for a venue, 1 person per 4 square metre rule. Sorry, it's 1 person per 4 square metres. So what it does is it's difficult, particularly for cafes, bars, pubs, restaurants, some retail. I'm not particularly keen on it, but unfortunately our case numbers are growing. And so to limit our case numbers and therefore limit the number of people who get very sick and come into our hospitals and limit the number of people who die, we have to look at those sorts of measures now.
What is that number? I mean, the Chief Health Officer did suggest on the radio there is a number, but they won't tell us. He won't tell us what it is.
We're just monitoring the situation. I'm not going to set hard and fast numbers. I've always found that that's a mistake. So we will monitor the situation, and the 4 square metre rule will be very hard for people, but we're monitoring. We haven't made a final decision on it as yet.
Why not just bring in the high caseload settings for everyone else now? We've got a lot of parents at home isolating with their children who can't go to school because they've been in contact with infected cases.
It's a balance. So the high caseload settings basically mean there's further spread of the virus, but you keep people going to work in essential industries. That's what it's about. So it's just a balance.
Can you tell us which hospitals the 12 people with COVID are in?
I don't know. I'm sorry.
Is there a plan about, is it just wherever people show up that's the hospital they stay in? Or?
Oh, yeah. Oh, well, that's managed by health. Lots of hospitals are prepared for it, and the advice we had was you don't have one hospital. That's just a COVID hospital. You have it so that people can be cared in whichever hospital they go to. But it may be that some more remote hospitals, and I think the RFDS has been very busy getting people to Perth, that people are flown out from country hospitals and the like to city hospitals, because city hospitals can obviously cater with higher numbers and are better prepared. So, this is managed by health, and I think they're in a range of hospitals.
Have you asked, or have you sought advice on how many of those people, I know it's 12 at the moment, but how many are vaxxed and not vaxxed? Because it sort of is an issue.
It is. I don't have an answer on that. We're hoping we'll be able to report that on a weekly basis.
Why aren't you listing the regions where people with COVID are anymore? At the beginning, we would see sort of on a map where the hotspots were, and some people in the regions are worried they're not finding out.
Well, obviously we'll try and put as much data and information out there as quickly as we can on the government website and my Facebook site and every other means we can communicate. I think we do ads in the paper and ads on telly and every other sort of thing to try and communicate as much information as possible, but I'll give you the most current and up-to-date data that I've just been given. The case numbers are these: East Metro 1,062, North Metro 967, South Metro 587, Goldfields Esperance 46, Great Southern 2, Kimberley 31, Midwest including Gascoyne 4, Pilbara 31, Southwest 37, Wheatbelt 7.
Can you explain why WA Health doesn't issue COVID updates at the same time each morning like other states do?
I think we try and put them out before 12, the information that we get in, and we try and provide as much accurate data as we possibly can. So, as you know, data moves around and things get reported at various points in time. We actually have the biggest state in the world, so getting all the information in is perhaps a bit trickier than some other places. But we try and report all the information by midday. I think the Chief Health Officer provided information on a radio broadcast this morning, but I think that was a good idea. He was doing radio. We had the most up-to-date information, so he did that.
If talking about data, have you been reading the discrepancy that was made yesterday, which changed the figures?
Yeah, that's right. I announced some figures. I think I announced 640 or thereabouts, or 620, 617 cases yesterday, and it turned out it was over 700. I understand there was some discrepancy or something that occurred within health, and we've corrected it today.
Has Western Australia ordered any COVID pills so far, given the FDA has approved it?
I don't know the answer to that question, but I know that when they become available, I think they might be. Prescribed by doctors, by GPs. I'm pretty sure the Commonwealth will roll them out across Australia on a fair and equitable basis.
Do we have an exact number of cases in Vijayanga today, and how's the Jameson outbreak going as well?
I understand the Jameson outbreak it has been managed very well. So the community has been locked down, and there were 6 cases, including 4 Indigenous people and 2 police officers. So that was the latest information I had. So I understand it's been managed very well by WA Police. I'm currently advised there are 27 cases in Bijadanga, 3 cases in Beagle Bay, 1 case in Broome, but the case numbers we expect are going to grow significantly in the Kimberley.
Some parents might consider to keep their kids at school because of recent outbreaks. Will they be penalised for keeping their kids at home at this point?
I don't understand what you're saying, but no, we're not going to be issuing fines to people. I just urge people to follow the rules. We've actually had the least disruption to schools this year of, I think, any state in Australia, so it's been managed fairly well.
With the rate of third dose vaccination in Vijayanga, I think you mentioned it yesterday, being quite low. Are there increased efforts to focus on third dose in that and other Aboriginal communities?
Absolutely, and that will continue. We put, just so you know, we put huge effort into vaccination in Aboriginal communities and for Aboriginal people, even though the responsibility was the Commonwealth's under the agreed guidelines between the state and Commonwealth. So we'll continue to do that to provide as much vaccination coverage as we can out there amongst Aboriginal people. What we went through last year was a massive disinformation campaign being promoted by some people to stop Aboriginal people getting vaccinated, and some of those people had very, very evil intent in doing so. And we've had to counter that as well. But the first and second dose rates of vaccination amongst Aboriginal people are climbing significantly. It's that third dose we've been trying to get up and done comms campaigns. We've had the Police Commissioner, myself, the Chief Health Officer, everyone out there trying to get Aboriginal people vaccinated. I'll just say to people across Western Australia, please get your third dose. Whether you're Aboriginal, whether you're not Aboriginal, get your third dose. The sooner you get your third dose, the safer you'll be.
There's concern about vaccination rates among Perth's homeless population. Professor Fiona Stanley and a few other advocates have written a letter to you today asking for urgent action to be taken for accommodation to be arranged, similarly to how it was at the beginning of the pandemic. Is that something that you're looking at doing?
Just a couple of points on that. We have had 50 COVID-19 vaccination clinics put in place for people experiencing homelessness. So 50 clinics have been run. We've had more than 100 clinics providing vaccinations for Aboriginal people as well. And we've had organisations we've worked with that deal with homeless people to roll out continuing vaccination programs with homeless people. We've set aside some hotel rooms if people need to isolate or people need to be as a close contact, or if people are positive who are homeless. We've set aside accommodation for people in those circumstances.
Premi, I'm not sure whether was the National Cabinet, nothing today, but from your point of view, obviously we're starting to see a lot of displacement of people from Ukraine. There's a Ukrainian population here in WA. Would you envisage a time when you'd open up and allow people to come here if that's what's going to be required as this moves forward through the Commonwealth?
I haven't considered that, but obviously we would work cooperatively with the Commonwealth on those matters. It's obviously a tragedy what's going on there. There's unbridled and unprovoked aggression by Russia is like something you read from the 1930s or 1940s. It's unbelievable what they've done. Just unbelievable. A European ground war. I didn't think I'd see it in my lifetime. So we'll obviously work with the Commonwealth on what needs to be done and what support we can give. But I just want to condemn what the Russian government has done in the strongest possible terms. It's just an incredible act of brazen, unnecessary, shocking aggression.
The changes for police and emergency services, do they come in from today?
I think it's from Monday morning, because we've got to set up the various systems and so forth. I'll just see if I've got that. The definitions. I might get back to you exactly, but I think it's from Monday morning.
Do you have an update on the state rat stockpile?
I'm sorry?
The state rat stockpile, rabbit antigen test.
I know what they are. Yeah. That wasn't my confusion. What do you want to know about it?
How many million have we got?
We got around 20 million. 20 million rat tests. We expect to have 100 million.
I mean, just back on the war in Ukraine, what do you think of China's lack of condemnation of Putin's actions and the report for easing trade restrictions with Russia?
Look, I just saw a tweet about that. My main focus is Russia. I think the world should be focused on Russia and what Russia has done. Mr. Putin and his behaviour is incredible. I actually didn't think they'd do it. I thought this was just sabre rattling to get some concessions and show off and be a big man around town. I actually didn't think they'd do it. When you actually invade another country, as Saddam Hussein learnt, the consequences can be dire for the country that does the invading. And the threats that Mr. Putin put out there yesterday, the threats of basically nuking any country that intervenes, were just so uncivilised as to be totally off the scale. And I'm just despair that the country with the largest nuclear arsenal in the world is acting like this. It is shocking.
I'm not sure if you're aware of this as well, but apparently we do take a lot of fertilizer products from Russia. I mean, is it something that you had to look at as to whether or not we're part of any?
We produce fertiliser here, so I don't know what that is. So hopefully if we produce more fertiliser and our farmers and gardeners use West Australian homegrown fertiliser, well, then that'd be a good thing.
Are the hospital testing clinics coping with the increased number of tests?
Yes, they are. I think it was, what did I say, 11 or 12,000 today. We have capacity for 35,000, but sometimes there'll be lines because everyone might go to one clinic whilst other clinics don't have anyone there. So all I'd say to people is if you're going to get a PCR test, there are a range of sites you can go to get them. You don't all have to go to the one clinic. But we also offer people the rat testing opportunity now, so people have a range of ways they can get tested.
Some people are actually reporting a delay in getting their results. Is that taking longer?
Not that I'm aware of.
Any booster plans for 12 to 15-year-olds? Any booster plans for 12 to 15?
No, that's subject to advice from the Commonwealth. So the Commonwealth will decide when the third dose can roll out to that cohort of people. At this point in time, it's above 16. So we're at 61% above 16. So without, we have the highest level of vaccination of third doses of any state in Australia. We have pretty much the highest level of first and second dose, or nearly. I think we might be behind the ACT, which you probably understand. So we've done very well in terms of getting people vaccinated before we have widespread spread of the virus. But right now we have the virus growing. We can't stop it. I just urge people, take care, get your third dose, do what you can to protect yourself.
Same response for 0 to 5 years old as well?
Correct.
Mark Duncan-Smith said earlier this week that someone would be more likely to catch COVID from someone within the state rather than a traveller, with cases continuing to rise. Is there any chance the border reopening would be brought forward?
No, it's March 3rd.
Last question, guys.
Thank you.
Thank you very much.